All right, guys, let's talk about testosterone replacement therapy or TRT in hair loss. Is it to blame? Should you be concerned? I want to give you my take on this. So, first of all, I want to take you back in time a little bit. There was a study done in 1965. It was a small study, it was only 21 men, but here's what they found. They applied testosterone propionate cream to the scalp of these 21 men. And during the study, they saw 75% of these men experience hair growth, not hair loss. Okay. There's another important thing to remember here. When you apply testosterone, or even if you inject testosterone, you can see a fair amount of it converted to DHT. Very potent androgen. It's much more potent than testosterone, but it really gets the blame for hair loss. That's why we have all these DHT blockers out there, or 5-alpha reductase. They're blocking the enzyme that converts testosterone to DHT. And they're like, that will stop hair loss because DHT is to blame. But if you're giving people testosterone and you're seeing hair growth and a lot of testosterone is converted to DHT, what in the world is going on? And by the way, in the study, the age of the men didn't matter. The degree of baldness didn't matter. 75% of them saw hair regrowth to some extent. Okay. So what do we have going on? All right. I already talked about the fact that testosterone propionate applied to the scalp, we know it can increase DHT and it's growing hair. So how can we be blaming testosterone and DHT for hair loss? Well, I think there's some things going on. I also want to mention it's really important to have healthy levels of DHT, not just for the androgenic effect, but it also acts as an antioxidant in the scalp, which is what we want to have. So what in the world is going on? Why do some men experience hair loss on testosterone replacement therapy? And what I think is going on, I think we're unfairly blaming TRT. I think we're unfairly blaming DHT. What I think you have to look at is if you're talking to your doctor about TRT, pay very close attention to the product that you're using. This is just an example of one testosterone propionate injection and found online. You can find this anywhere, the information, but it contains testosterone. It also contains benzyl alcohol and cottonseed oil. Okay. Benzyl alcohol can actually lead to metabolic acidosis. It can cause a number of issues in our body. Granted, these injections have small amounts of it. I'm not saying that's going to happen to you, but it's not the best thing to be putting in your body. And cottonseed oil, as I've talked about a lot on my channel, it's a polyunsaturated fatty acid. It's terrible for metabolism. It does a number of other terrible things, including potentially leading to hair loss because it's not healthy for your metabolism. As metabolism slows, we can see things like hair loss, hair thinning, those sorts of things. So I am more on the side that it's not testosterone or DHT. Is you have to be very careful about the purity of the products that you're putting into your body. Again, I know this is controversial, but like I pointed out, we have studies showing that applying testosterone cream led to hair growth, not hair loss. So hopefully that video was helpful, you guys. Let me know in the comments other video topics that would be helpful for me to cover. Make sure there's a link in the description. Go grab your free checklist. I think that'll be very valuable for you. A lot of things in there that I don't think people think about. There are things I personally use and recommend. So go check that out. It's free. And I will see you in the next one.